Today we're going to take a look at Medicare Supplements, also known as Medigap plans, and how to figure out which one is best for you in 2022. Hi, I'm Tabitha Moldenhauer, broker with Benefit Consultants Midwest. If you haven't already, please take a moment to hit the subscribe button. We have new helpful Medicare content every week. Medicare supplements are much older than Medicare Advantage plans and Medicare Part D plans and have different rules and laws governing them. If you have a Medicare supplement, you don't have to worry about network changes every year because if you have a standard Medicare supplement policy, there are no networks. You are allowed to see any doctor, use any hospital, any provider who accepts Medicare. This makes Medicare supplements very popular with people who don't want their choice of doctors to be restricted by an insurance company. You also don't have to worry about benefit changes. Insurance companies can't make any changes to Medicare supplement benefits. These plan benefits are standardized by law, so the only time benefits change is when a new law changes Medicare supplement benefits across all companies. And there's no need to compare Medicare supplement plans during the annual enrollment period between October 15th and December 7th because Medicare supplement plans are not affected at all by the annual enrollment period. They are month-to-month contracts that you can change at any time during the year. The rules for changing Medicare supplements do vary from state to state and can depend on your health and how long you've been on Medicare. If you are beyond your first 6 months on Medicare Part B and don't have a guaranteed issue right, you will have to answer health questions, provide a medication list, and pass health underwriting to be able to purchase a new Medigap policy. For most people, that isn't a barrier to changing your Medicare supplement. More information on Medicare supplement underwriting can be found in the video linked above and in the description below. Medicare supplements, or Medigap plans, describe what they do right in the plan name. They are supplemental insurance plans that fill in the gaps that would otherwise be your out-of-pocket responsibility in Medicare Parts A and B. Medicare Parts A and B, also known as Original Medicare, are your primary insurance. If you have a covered medical expense, Medicare pays its responsibility first, then your Medicare supplement will pay based on the plan's benefits. The coverage chart on the screen shows what each Medicare supplement plan covers. You can choose a Medigap plan that covers all or almost all of your Medicare Parts A and B deductibles, coinsurance, and copays, or a Medigap plan that provides catastrophic coverage only, or a Medicare supplement plan somewhere between those two extremes. Because the coverage is standardized by law, once you decide on the lettered plan that has the coverage amount that you want, that lettered plan will provide exactly the same benefits regardless of which company you purchase it from. I know it looks like there are a lot of Medicare supplement plans available, but in reality, some of these plans are not commonly sold. Insurance companies that offer Medigap plans have to offer Plan A, and beyond that, insurance companies get to choose which other plans to offer. Some of the plan designs don't make a lot of financial sense for Medicare beneficiaries, so very few insurance companies will even offer those plans. That's the case with B, D, K, L, and M. Also, plans F and C are only options for people who have effective dates on their Medicare card for Parts A and B of before January 1st, 2020. And even if you have been on Medicare long enough to be eligible to purchase a Plan F or a Plan C, it's not a good idea. More on why that is in the video linked above. After those eliminations, the plans that offer the best value for consumers for 2022 are Plan G, Plan N, and High Deductible Plan G. Let's look at each of these plans in detail. Plan G is the most comprehensive of the three. For all medical care covered by Medicare Parts A and B, Your out-of-pocket risk with a Plan G is limited to the annual outpatient Part B deductible. In 2022, this deductible is $233. If you reach that deductible, all covered outpatient expenses beyond that are split between Medicare Part B and your Medicare Supplement Plan G. This includes things like office visits, diagnostic testing, and all outpatient treatment. On the inpatient side, all costs are split between Medicare Part A and your Medicare Supplement Plan G. You have no out-of-pocket deductible for any inpatient care. Because Plan G is the most comprehensive coverage with the least out-of-pocket risk for you, it is the most expensive of these three Medicare Supplement plans. Since Medicare Supplement prices generally increase every year as you age, we need to think about future costs in addition to the initial cost when you first apply. Plan G is the most expensive when you first enroll, and you can expect the annual increases in the monthly premium to be more than what you would have with a Plan N or a high deductible Plan G. So who would a Plan G be a good choice for? If you have very expensive ongoing treatments like chemotherapy or treatment for rheumatoid arthritis, or any other medical condition that needs costly or regular medical treatment, a Plan G can be a good choice for you. The higher Plan G monthly premium is balanced out because you don't have the out-of-pocket risk of copays and deductibles every time that you have to go see a doctor or provider for treatment. At the opposite end of the coverage spectrum, we have high deductible Plan G. This Medicare supplement provides exactly the same coverage as Medicare Supplement Plan G with one big difference. You have to meet a high deductible with out-of-pocket spending before the high deductible Plan G will pay anything. In 2022, that deductible is $2,490. If you have a high deductible Plan G, you pay the Medicare Parts A and B deductibles, copays, and coinsurance up to $2,490. If you reach that amount in your spending, then the high deductible Plan G kicks in and pays just like the standard Medicare Supplement Plan G. Because this plan has the least amount of coverage and the most out-of-pocket risk for you, it has the lowest monthly premium. High deductible Plan G also has the smallest premium increases every year. Who's an ideal candidate for a high deductible Plan G? If you are pretty healthy and don't need much medical care, this can be a great way to protect yourself from catastrophic medical charges while also saving a ton of money on Medicare Supplement premiums. In many parts of the country, the premium difference between a standard Plan G and a high deductible Plan G is well over $100 per month. Medicare Parts A and B have no out-of-pocket spending limit for beneficiaries. If you only have Medicare Parts A and B, there is no limit to how much you can potentially spend on your medical care during a calendar year. A high deductible Plan G provides a cap on how much you can spend in a year. And if you have a serious illness or injury, you have the assurance that your spending, in addition to the monthly premium costs, is capped at $2,490. Then in the middle of the coverage options, we have Medigap Plan N. This is a somewhat newer Medicare supplement plan, and it grows in popularity every year. It is similar to a standard Plan G, but slightly less comprehensive. There are two differences between Plan G and Plan N. Both of those differences are in the outpatient side of the coverage. Inpatient coverage is identical between G and N. One difference is that Medicare Part B excess charges are not covered by Plan N. In most cases, that's really not a big concern. The only time that you can get an excess charge is if you see a doctor who contracts with Medicare as a non-participating provider. Only about 4% of Medicare providers contract as non-participating providers. A non-participating provider accepts Medicare patients but does not accept Medicare payment as payment in full and is allowed to balance bill patients up to 15% of the Medicare approved rate. That is your Part B excess charge. To find out how your providers are contracted with Medicare, you can use the Physician Compare tool at Medicare.gov. A few years ago, one of our Medicare Supplement insurance companies looked at all of their claims for the year and found that 99.34% of them did not include any excess charges. Of the 0.66% of claims that did include excess charges, most of those excess charges were less than $20. Excess charges are very rare and they aren't automatic even if you are seeing a non-participating provider. The provider can decide whether to balance bill a patient on a case-by-case basis. And if they do decide to charge an excess charge, it's not always the whole 15%. 15% is the most they can charge. Sometimes you will have an excess charge that is less than 15%. The risk of excess charges for most people is so low that paying extra for insurance to cover that doesn't usually make a lot of sense. The other difference between G and N is that with Plan N, after you meet your Part B annual deductible for the year, which again in 2022 is $233, you may have co-pays of up to $20 per office visit and $50 per emergency room visit. The emergency room copay gets waived if you are admitted to the hospital as an inpatient. Those office visit copays are not charged at every office visit. It depends on how your visit is coded by your provider's office. So it isn't guaranteed that you will have a copay at every office visit that you have, but if you do have a copay, it is capped at no more than $20. Because Plan N has middle-of-the-road coverage between Plan G and high-deductible Plan G, it also has middle-of-the-road premium costs. If you're trying to decide between a Plan G and a Plan N, look at the difference in premium cost between those two plans in your zip code, and also count up how many office visits you are likely to make in a calendar year. Premiums vary widely from state to state. Here are a couple quick examples from Illinois. For a male age 70, a Plan N has a premium savings of about $35 per month over a Plan G, for a total of $420 per year. If he makes far fewer than 20 office visits per year, the Plan N is the better value. For a female age 70, the Plan N saves about $30 per month versus a Plan G, for an annual savings of $360. If she typically makes fewer than 18 office visits per year, the Plan N is the better value. Considering future premium increases, since Plan N has slightly more out-of-pocket risk than Plan G, the premium costs increase more slowly than Plan G. That has been the case every single year since Plan N was introduced, and it is expected to continue. Once you've decided on the Medicare Supplement plan that has the right level of coverage for you, it's time to comparison shop every company in your zip code that offers that plan. Although the coverage is standardized by law, the costs from company to company for the exact same plan are wildly different. Different companies use different pricing models. So it is really important to do detailed comparison shopping and research before applying. It can save you a lot of money initially and in future years. And this is what we do for all of our clients as Medicare plan brokers. We work with multiple companies so we can impartially shop all of the companies available with you to find the plan and the company that's the best fit for your situation. We do this completely free of charge to our clients. We're able to do that because for every enrollment into a Medicare plan through our office, We are paid a commission by the insurance companies. The commissions are pretty similar across different plans and different companies, so we have no reason to push one company over another. We're free to find the plan and the company that fits each client's best interest financially and medically. And the Medicare plan cost is the same to you whether you purchase direct from an insurance company or through a Medicare plan broker. Once you are a client of ours, you have free ongoing access to expert help whenever a question comes up or an issue comes up with your insurance policies. We're also here to help when premiums go up or plans change and you need to reevaluate, do some comparison shopping again, and possibly enroll in a different plan. If you have Medicare Supplement questions, please feel free to give our office a call at 877-312-1414 or visit bcmwi.com. We're here to help you understand your options and find the best Medicare plan for you. Have a great day.